the week has not ended, but the problems are emerging left, right, center. So as much as possible, we'll try and find solutions to them. But you're still, you know, on Tuesday wahala, and another wahala, you know, hitting us hard. It has to do with our health, personal health. And in the area I mentioned earlier on in the show, that we're talking about something that probably has to do with women more. I don't know if it has any link with men. I think it does. To a certain extent, I think it does. But yeah, we'll be talking more about the urinary tract infection. Maybe there are types, I don't know. But I will tell you more after this break.
The contest for Nasara government. You know, Nasara as a whole have so many problems.
Look at the generational capacity. In 2007, when we were met with the energy crisis.
And it's dark in color. No, this one is very.
Tuesday Wahala is here, and I'm privileged to have Dr. Mercy Abrafi Asante, and she's actually an alternative health practitioner. Alternative health practitioner. I love such doctors. They are my newfound doctors. I don't know the old ones anymore. Doc, you're welcome.
Thank you very
Good morning.
much. Good morning.
Why are you an alternative health practitioner?
Well, you see, basically, health cannot be health without natural medicine. Almost all the medications we have in town, they are from our natural resources like plants and animals, minerals. So we cannot eliminate alternative medicine when it comes to natural way of healing.
So, you know, the funny thing we have done is we call it alternative medicine instead of it actually being the original medicine. Why do we call it alternative? Why should it be so? Why? You are the doctor and you have decided to go into that field.
Okay.
So I think you should be championing that cause. It's not alternative. It's actually the original.
You see, now the world has highly accepted it to be the mainstream of health, and so for we to be able to say that yes, herbal medicine, naturopathy, nutrition, those are the basic of health, it will be very difficult. It will be very difficult. But you know what, those who are in it, they really know that even the medicines they are preparing, they use a natural source. Just that there are some adjectives and some chemicals to make it, let me say, more easily to swallow or that kind of. You get it? It's very difficult. Can you believe that up till now they are still fighting alternative medicine?
I know.
And so the and in a way the government and the parliamentarians can also help. They believe in it. They do visit. They know the, let me say, the benefits in alternative medicine. But what are they also doing? Even as you push it, if you are not careful, you either lose your job or your life.
Yeah, that's true. I know that the rift is very, very high, and you guys, I don't know, they fight a lot. The doctors and the alternative doctors, I don't know, the other doctors, they are called what?
Doctors.
Orthodox doctors.
Yes, orthodox.
Maybe orthodox, yeah.
You see, the word orthodox,
yeah.
Let me say, Hahnemann and those who brought, let me say, the early doctors, they know that when we say orthodox, meaning something that people have really accepted it. Now, when we go into health, let me say Ghana alone, how many people go in for alternative medicine and how many people go in for orthodox medicine? The orthodox medicine. You get it? Everybody knows that about 80% of our population loves to go the alternative way, especially herbal. Yet we call it orthodox. Just that one mostly we link it to the emergent ones, emergency kind of diseases. At least the alternative cannot really attack it at the emergent state, and so we give that role to them to play. But there are so many chronic diseases. If people shift to the alternative side, they can get a best care.
I agree completely. And just I would just use this opportunity to, you know, I don't know. I'm not going to tell you to stop using orthodox.
Oh, no one is
exactly system of medicating, but trust me, I discovered alternative. I heard about it. I didn't even know that I would grow to love it, but I've grown to love it so much that anything orthodox, I don't want to even hear about it. I just want to go the natural way, and it helps. Yeah. So sometimes you need to try the natural way. Trust me, it does help. It goes a long way to help, but don't abuse it. Yeah,
that is the main.
Yeah, that's the most important thing. It can also kill you if you actually abuse it, so don't abuse it. I saw a post that someone sent to me. It says that we jailed a lot of people in those days when they were selling weed and they were making money from it, and we said it was no good. Now the same people who were jailing us are now
using it for other,
turning around and using it. So that's how wise you have to be. As wise as what a serpent. Yeah, be as white as a serpent. But Dr. Mercy, thank you. Today you're here for the urinary tract infection.
Yeah.
Yes, what is it?
Well, when we say urinary tract infection, it is infection, let me say, disease associated with urinary tract. Let me say how we are able to eliminate waste through the liquid form in terms of the kidneys, the ureters, the urethra, bringing out urine. Any disease associated with those particular organs, we say urinary tract infection. Any infection at all. It can be like so organisms. Organisms can cause them. Let me say, let's put it that way. Can infect those areas and then cause other medications too. Can cause them. And then sometimes sexually transmitted diseases, when not treated, can link to the urinary tract infections.
So the organisms you are talking, what are those? Some of those organisms?
You know, in olden days, mostly people will go and swim in the stream, and then by the time they realize 2-3 days they are urinating blood and having difficulties in urinating. Those are some of the organisms that mostly causes. And then for the, let me say, what really caused these days, the E. coli. You know, the E. coli, we get them through the foods that we eat, the water that we drink. When it is contaminated with these bacteria, they get into our system and then try to affect. There are some also that get exposed directly from our under and then gets to the urinary tract organs and starts to disturb them.
Can you get urinary tract infection from maybe an unclean restroom?
Yes, washroom? You can get them. You see, sometimes some people will go and urinate. If it is a water closet, they will go and urinate, and then by the time you realize some of the urine has split on it, immediately the person stands up, you go also to sit on it, and then if in case there are some organisms or let me say animals on it, they may enter straight and then start to...
I'm cringing right now. When you use public washrooms, clean it. Always try to carry tissue with you, because it's not all the public washrooms that have tissues. So carry small
you know, sometimes you go and meet it, you would think that, oh, there is no urine on it, but you cannot see them with your naked eyes. So you have to always be carrying some kind of, let me say, antiseptics and sanitizers.
I don't know if sometimes I feel like I'm acting too much or I'm overreacting. You see me in the washroom, I have all kinds of things. Put it on the seat, clean like before I sit.
I also do that. You know, in health we have to. There is this thing, one of my lecturers used to say that treat everybody like HIV patient, treat everybody like, let me say, hepatitis patient. So it doesn't matter if it's your friend who just entered and you had to follow. As soon as you go in there, imagine that the person may have any, yes, and so you have to clean it before you use this.
So apart from cleaning the seats, in the closet itself.
In the closet.
Yes.
You know, the way and manner sometimes we sit on the closet to will attract us getting it. Some people will sit just directly where the water is. And so if you are having, let me say, a hard stool, as soon as it drops, the water will splash and then
No, pretty old can your mouth. I can't ask the question again.
You see how ugly it looks like, but and then especially with men like this, I always have problem with them. You see, sometimes they don't really focus about their health. They just go and sit on it, and by the time you realize their sexual organ, say the penis, is lying on the seat.
On the seat.
It's just on the seat. Who knows? Maybe sometimes they even see urine on it, but they ignore. It's the ladies who really care about cleaning it. But the men, they'll just go and sit on it. By the time they realize, they pick infection from there.
So even the men, you should be cleaning.
Yes, they have to.
Before they sit.
Someone once told me, and the person has been doing it, even after urinating, he cleans it. He cleans it. He cleans his organ. I'm talking about his penis. He cleans it and throw the tissue away, like the ladies how we do it. Yes, they wipe it away.
So clean the seat before you see, both girls and boys. And when you're done using the bowl, you need to clean yourself. So if it's the guy, they should clean their penis.
You don't have to sit in a way that your anus is just direct to the water in it. It will splash and then it will just touch your skin.
You're making me imagine things I don't like to. I really hate. Okay, let's move away from that. Enough of the bowl, the toilet bowl. Let's come to the symptoms. If you have a urinary tract infection, how will you feel? How does it feel like?
At the early stages, you start to experience some kind of itching in your genital areas. You might be experiencing some burning sensations. Urinate, even before urinating, sometimes it comes, but majority of it, whilst urinating, you'll be experiencing the burning sensations. Aside the pain, you might get lower abdominal pains because you know the tract is just at the lower abdomen, and so you might be experiencing those.
How's the pain like?
The pain, you see, apart from the burning, sometimes you get some pricking pain, especially if it's because it's infection, you know, whether bacteria or virus being there, they will start to eat there. Some people do experience some pricking pain. They will be there and pet, like they just tell you that I feel like there is a bite inside the organ. Yes.
It feels like a bite.
Like something has bitten you, or an insect has just something like that.
What was the difference between that and candida?
You see, candida mostly is one of the sexually transmitted diseases.
Okay.
It's not really related to urinary tract. But you know, when you get sexually transmitted diseases, you can fall into the urinary tract. Because they are very close, the organism can just pass and then go to the urinary tract and disturb you. You see, with women, although it comes easily, but with men, because it's the same organ, you might get sexually transmitted diseases, and then we may say that, oh, you have urinary tract, because the symptoms look alike, unless maybe we look in for which organism caused it. That is when we are going to say, oh, you had it through sex. But majority, let me say, majority of the urinary tract infections, they are associated with sexually transmitted disease. They brought it.
Do producers want to open the phone lines for a few calls? Can you let me know? Okay, so
some will also be experiencing.
I'm sorry, let me just put the numbers out. So you will open the phone lines. Be quick and call. Our time is up, but we'll just give you the opportunity to say a thing or two. 050-1318-143 or 050-143-2820. Any of those two numbers you can call. I think it will be placed on the screen. So call and let's know what you, if you're experiencing something you want to talk to doctor. 050-1318-143. Call either of the numbers and tell us what you think.
Some too may be experiencing some discharges, whether a vaginal discharge or penile discharge. Some discharges come, you know, especially with the men, they'll be like, I don't really get the discharge as I'm visiting the toilet, or let me say I'm stooling, that is when the discharge comes.
From the anus? Or
No,
from the penis?
From the penis.
Ooh.
They will see the whitest discharges coming. And then in the worst conditions, let me say when it gets to chronic, if you don't treat it, that is when it builds up, trying to affect the kidneys, and so you'll be experiencing that frequency in urination. Within short time you want to, and yes, even as you go,
so
sometimes
urinary tract actually gets weak.
Sometimes you will go and then the urine wouldn't even come at all. Some also comes, but then in pieces. You feel like it looks as if the bladder is not really empty, and so you want to go another one. So it keeps coming. Some people will urinate about 8-7 times in a night. For day, plenty.
But you might be confused, because I drink a lot of water. Okay, I actually pee like once or twice in a night.
You see?
I drink a lot of water. Maybe you'll be confused. Oh, this is very serious. The number of times you pee.
You see, some people do confuse themselves. The moment they start peeing, they think it is the water that they take in. To the extent that some people even don't really take in fluids. But then as they pee, they think it is the water that they have taken in. That is why you have to just associate any other symptom with it. If you have been getting any burning sensation, any lower abdominal pains, any backache, especially at this area, the lumbar area, you'll be experiencing some frequent pains. The drivers like this may think that, oh, it is because of the long sitting in the car, that is why they are experiencing the lower back pain. But then by the time they realize, it has reached the chronic stage.
Wow.
Yes.
So that's how that disease works. It creeps in small.
It can destroy your joints, because, you know, uric acids and urinary tract, they are just like, let me say, siblings. And so they will start attacking joints. They can start attacking blood vessels. That is when the bone problem starts to show up. The arthritis, and then the osteoporosis, and then, yeah.
Wow. Okay, 05013181143 or 05014322820. When you have, okay, hello. Okay, sorry. When you have a, I don't know, what's the early stage? Does it give you any signs that you have urinary tract infection?
There are some people who wouldn't really have symptoms relating to it, but some too, especially when your immune system is down, you start to experience that frequent urination, pains during urination, burning sensations, the discharges. When your immune system is down like this, within short time you start to experience those symptoms. And so you might be fortunate enough to treat it, and then it's easily treated. You can easily treat UTI. Only that those people who just sit at home trying to say, oh, tomorrow, that, giving excuses, that is when it gets to the worst stage and the kidneys are affected. You can get kidney failures with it if you don't treat it. The kidneys can damage, and then the bladder too can damage. In a way, it can also affect the prostate, and so you start to have that difficulty urinating and stuff. And if care is not taken, you'll be given catheter. A rubber will be passed through your urethral walls.
I see. So what's the treatment if you say it's that easy? Maybe you might not see it in the early stages, so you might think you don't have it. Do you always have to be? Okay, let's pick a call. Hello, Mike is calling from our Washington. Hello, Mike.
Good morning.
Good morning, Mike. Thank you for joining us. Let's hear you.
Thank you. Please, I want to ask Dr. some questions.
I'm sorry, lower your TV set or move away from it.
Yeah.
Move away from your TV set, please. Okay, I'm sorry. When you call, kill the volume. Kill the volume on the TV. It gives us feedback. It's not good for you. So 05013181143 or 05014322820. Mike, if you can call back.
You see, one danger also is if you don't treat it, it's also going to affect your fertility rates.
As a woman? Or
as a woman, as a man, especially the men. If it is relating to the infection, that they can just destroy your sperm cells. You know, and the sperm cells, they are always related to your scrotum and then the prostate gland releasing semen. So you just have to treat it as soon as you detect any such symptom that we have mentioned here right now.
Now that you mentioned sperm cells, let me ask you. Sorry, Walasu is calling from Kumasi. Hello, what's up, Walasu?
Yeah, please. I want to ask the doctor. Sometimes I feel some pains in my testes. I just also to find out if the symptoms of it's a symptoms of the
urinary tract infection. How's the pain like?
Sometimes not all that severe.
But you still have to check it because it's not normal for you to have pain in your testes. Please keep watching. We might put her number out, so just in case you want some private discussion, you may want to call her later. But keep watching. Thank you. 050-1318-143. What do you have to say to that?
You see,
does it give you pains in your testes sometimes?
When it gets to the chronic stage, it may give you, but mostly sexually transmitted diseases can also cause the pain. There are some people who also really don't have problem, but it depends on the kind of panties they wear. Some wear too tight panties, and then by the time they release, or let me say remove the panties, they have had some let me say constrictions around their testicles, and so they might think that.
Some don't like wearing panties, and they think is the healthiest. You are the doctor, so you tell me.
Please, you have to wear panties.
Why do you have to wear panties? There was a joke that research has shown that ladies who don't wear bra have longer
lifespan.
No, longer breasts. So when the men heard that, they also stopped wearing panties.
I'm really not. I've not heard of it.
Yeah, I've told you.
Oh, okay.
Okay, so you think that it's advisable they wear panties or boxer shorts?
They should wear, but not too tight ones.
Not too tight.
At least you have to experience some aerasions around your genital areas, but not too exposed. You know, clothing us in general. I've been saying it. Sometimes you don't.
Okay, I'm sorry. Nana Kwame is calling from Dansuman. Hello, Nana.
Yeah, hello.
Good morning. Thank you for calling us. Let's hear you.
Okay, I just finished the program and I saw this when I want to ask a question.
Go ahead.
Yeah, recently I was having problem in my genital penis precisely, and it was severe pain. So I went to CS, and there was no yeast, but I was having a problem. So I did that over and jerk mine. And after there was still no problem found. And later I went to the hospital. Then they tried me, told me that I'm having a infection. But the thing is, I want to know if you release sperm, it's supposed to be genuine. Because I see stuff in my not precisely. It is genuine. Like cloth. So what is that?
Hold on. What do you release that is cloth?
That is sperm.
Sperm.
You know, some clotted like jelly.
When you release sperm, is jelly like or cloth?
Yeah, like jelly like I think they are lump.
And you think it's not normal, right?
Yeah, I feel it's not normal.
Okay. Are you married?
No, I'm not married.
So how are you releasing the sperms?
Oh, I have a pregnancy.
I'll talk to you later. Okay, thank you, Nana.
Well, you see, one thing is, especially with sexually transmitted diseases, you know, as you are exposed to it, you might not be detected at the early stage because every organism has its incubation period and stuff. So as you experience the symptoms, sometimes you go to the hospital, they will check and will not see it unless the incubation period is over. Let me say 6 months, 3 months, some even 1 week. So if you're exposed to it and let me say within 3 days you go to the hospital, they might find nothing and tell you that you are okay. But then you have to wait for some time. But waiting for some time may also lead you to the chronic stage. Okay. So
let's allow some ladies from Kumasi. Hello, Portia.
Hello.
Hi.
Good morning.
Good morning. Thank you for calling us here on the first show. Let's hear you. And now, Pesoka Asante.
Yeah, that's the reason why I'm calling.
Okay.
I wanted to plead with the doctor. Say, if not all of us we understand the English, and the program is very interesting. So, if she can help in the way, so better translate it into Chia or Akan language for some people to know what is going on. I think that one will be far better. If she can help her combine the English and the Akan language, because the Akan language is a word in Ghana.
Yeah.
So a lot of people will understand, because what she is saying, most of the people don't understand English. And I think we have a lot of problems. Maybe uneducated now, and that's almost English, not more. The doctor nature program now, so a lot of people you will have problems, and it leads to the lower kidney, those kind of kidney problems. I think I would say boy say or English and or translate we because here now almost several for no problem next what in terminal and one is about hospital.
Okay, you Portia that's a power. Okay, so well, we are restricted here because we're supposed to be speaking English on GNTV. We speak Chi on ATV. So, but for the purposes of those who have specially requested, we'll mix it up for you so that you'll be fine. Okay. So I think basically, let me just quickly do it in 2 minutes. Basically, what we're trying to talk about is urinary tract infection. Your friend urinary tract infection. A kind of short friend UTI. It's an infection. It can be sexually transmitted. And I say
can I go?
Please.
Okay. Yeah, can't Junsomu yare. Yes, see Junsomu yare ne yare bia yenya free and yama boy my engine so brony beka say kidney no usa no urinary tract there Johnson fomoba ureters there boama esone ensuo so weni pedue no ma efa yen Johnson mo eba no enti yare bia ewo saa anwema no hone ne efre ne UTI urinary tract infection and I say disease na ye di ho common na yesi se unhu se ana se sebe ya obehu se saa anwema ni bia ba ho no obeta Johnson tentem obeta enya yaw abra wo Johnson obeta ehu se bia ensuo fitaa bi fi waseba se ye oben mama na asa oba mu hu se saa anwema ne ba wanya saa yare ni bi ebi o ha ye mmoa bi na de ba se de esi yusu ye toilet no yetimi nya bi afenso so no obi o ha wone ne yonko share panties and they still odo ni bia babati yen mu bi eye aha enti ena enemu yare mu bi nso so timi ma saa anwema na eba se bia woni oba na be ma to be ma oba to oba enhia mudie mu no se mo bi woni pa ne ho a etimi kwa wo ho titiri no ona se bia omo pese omo de oma no ene have sex no eno nso betimi aboa ma emmoa betimi akọ baabi a ye Johnson fan na afi akofa ohabo yesi se unhu sanwema ya ye boboso yi bia na wohu na watu anamontem wontu anamontem a ebetima say kidney na etumi nso nyine akofa dompe mu yare ba titiri pa ne wachi dompe ni ukotodwe nom no aha lower extremities no a time ma e de yaw joint pains apostle yaw eba ye beka say when you arthritis near the adeninyina sometimes urinary tract junsom yare ne kofa sa anwema ni nyina ba enti yesi se wonhu se one o junsom tentem junsom so sometimes so kwa agese wo chim ansa na aba ana so say bia hu se nsufita free waseba oben mamu ba o junsom e mo hyehyew hu moja wo junsom emema na entai hu emoja ne because time bia no mujina ba bi junso and all Johnson no cry no on share Johnson any but ye may na sometimes ye Johnson go ade mo na ye time ho enti time bia no wo ha wasa wo hwe wo Johnson any na hu say problem bi wo ho na watu na montem na nei no kidney yare na adoso teteno na nka o manya 80 90 na wo kidney problems but nei no youth no ubeko kolebu ubeko rage ubeko he kidney problems are dos me stress unhu sanyo mana enfan sha ho so ye driver ni na wo sisi etaye o ya menka se internase pi no well eno so wo honom internase pi no etime ma wo sisi ya but se wunya UTI bia wo sisi betime ataye o ya pa onu adru kra enko enti na wabo ho modern se obeko hospital na ya hwe ama na free ho no
me da say why easy I was struggling but thank you very much so the treatments we can only come to the hospital or we can do something at home
well ye betimi aye bibi say unhu say what start experiences are symptoms bia nema ban to say Johnson tentem ni ade enkasa wo Johnson tentem ti wonum nsuo ana wonum ade bia fluid mesro e wasa wonum no in a way mo ani bi sote enti no e wasa wonum nsuo pi enkwanu nsuo anajo during the day anopa wo start anu ahya se anom tentem se be abadwu nso but one thing so ne se mesre se bia we wo ha na so wutie yen wo hwe yen na wo ye nipa bia wo ta de dwonso hye wo ho amepa chew eno nso so kra na timi ma ade ne ye west eni kwan se wo de dwonso hye wo ho nyankopon ne nim ne enti a obo dwonso wo dwonso no enuama bi free ni peduane ho apart from emoawa no enuane bia na nka eni kwan se tena ni peduane mu no efa dwonso ni mu ba enti ni kwan se de dwonso hye ho kra bebi o bebi a tinkane ba se dwonso na wo se wo dwonso mepa chew dwonso ena se ohun se bi ba mesre otu ana montem enu ne hia pa enu nti ne abetena ha ye discussing ye mpese obi a be yare ana se obi a be kwa ho hia because of kidney problems any other associated diseases nti ne abetena ha ye bonka ye se mesre pe anamotu ewo ya conditions ya ye keka ho ase because ehun semsem ne de edoso pa.
Is there anything that we can take at home as first treatment, maybe some leaves or something we can drink?
Well, apart from insuo no, something like pineapple in a way and also ebua kakra. Pineapple juice. Me pa cheka pineapple juice enko gina baby enko to ade aya ni konkoma processed one no. Wa to abrobe na wa blend it. O blend no betime de akakadro kakra tum na ahwenti akakra tum enumpo eku bacteria. Enti wonum a eno so betime relieve you yaw no esobete emoa ni bi sobete but still you have to visit the hospital because bia na ye namu na wonya yare no e ma ne kopie honum enti say ya wo de na ye viral na me chire we me say fa pineapple ni ginger kakra hwenti ane ade na wokoya wotena ho e be ye worse enti ko hospital ni ye hwe say wo de no e de na e kofa baaye na ye nso ano ye call the root cause of it no na yentu ase no ne hia pa.
Okay, so basically what she's been saying in for those of you who probably didn't catch it, she's saying that if you detect or you suspect that you have the disease, you may want to cultivate the attitude of drinking a lot of water, because when you take so much fluid it takes away some of the bacteria from you. And then if you feel like you are pressed with pee or urine, don't hold it back. Please find somewhere as soon as possible and urinate. Then you also cultivate the attitude of drinking a lot of pineapple water or pineapple juice, not the one that's processed, kept in a can or a bottle or anything. Buy the pineapple, juice it yourself at home and drink it. Mix it with ginger or something and then drink it naturally. Keep drinking, and that it reduces the bacteria. But most importantly, you want to visit the hospital and get a treatment that will release the whole, will treat you totally or wholly from the disease, so that when they find the root of how the disease was contracted, then they can find a solution to it as soon as possible. So this is what we can give you, but where are you located?
I'm at Evolution Healthcare Center. Evolution Healthcare Center. Yewo Kaneshi. We are at Kaneshi. Metro Mass. Metro Mass. There is 2 Metro Masses in Kaneshi.
Okay.
But there walk hono Winneba Station. Malam station. Ubisa Winneba station, Metro Mass, and Akofo Basa, Eko Winneba, Ehwane ewo. Metro Mass no ewo yenim, yen building and pair, and ewo. Then at Pokuase, Ga Odumase. Ga Odumase, it's inside Pokuase area. Okay. Ga Odumase. And also we are at Top Radio. Top Radio. If you want to reach us, our number is 0555 205235. 0555 205235. You can also follow us on WhatsApp, Facebook, Instagram. Instagram Evo Care GH, and then Facebook Evolution Healthcare Center. Sometimes we do some updates on health. Into bit me follow now also kakra. But the important thing is if you detect UTI, you come to our facility. We will use the natural way to treat you. Any side effects that is most important.
The side effect is dire because it can eat into your body. Is it expensive?
Not really.
Are you sure?
Not really, no.
When you say not really, it means it's expensive,
you
but
see,
not really.
There are some, they have stayed in the house and it's about 2 years. And then with the 2 years, we will have to maybe have some lengthy time in treating it. So if there would any acute, I feel the one who say, abanity and the partial, within short time. You are okay.
Two hospital, bet me spend it. If you UTI, bet me spend by saying, yeah, acute that acute.
Bear 200. You can
treat yourself. Okay. So this is a private hospital. You may want to go there and find solution for yourself. Evolution Healthcare Center. Into healthcare center. So when you get to Kaneshi, in front of the Metro Mass bus station, you find them there. You go to Pokwasi Dumasi around Top Radio, you find them there as well. But the numbers also are 0555 205235, 0555 205235. Some of you called. I couldn't speak with you because your volumes were too high. You can pick up the numbers and call them because some of the issues can be quite private. You want to discuss your private issues with them and find the solutions. Doctor, I thank you for your time.
Thank you.
She is Dr. Mercy Abrafi Asante, an alternative health practitioner, Evolution Clinic. And your friend is saying alternative needed. Magiatu. I know it's very. Yeah, it's very. I'm not.
You know, there are some. Instead of seeking to know the knowledge aspect, they don't really seek.
Yeah.
Obesity. Or we are not comfortable, and the person is bold enough to tell people say.
All right, thank you so much.
I'm not tired.